Yeah, my name's Dr. Ryan Lynch. I'm at the University of Washington and Fred Hutch Cancer Center, where I treat and specialize in lymphomas. Lymphoma is a cancer of the immune system. There are types of immune cells called lymphocytes, which when things don't go right in an immune response, they can develop the ability to grow and divide and spread throughout the body. And in essence, that's what lymphoma is. And diffuse large B-cell lymphoma is the most common subtype of lymphoma, or more subtype of non-Hodgkin lymphoma. It's the most common subtype of that. Approximately 25,000–30,000 individuals are affected by non-Hodgkin lymphoma a year, the majority of which are going to be diffuse large B-cell lymphoma. It's typically diagnosed through a biopsy of an abnormal lymph node or an abnormal site in the body. So when I say abnormal, a patient may have a scan or an x-ray or even just feel something on their body, whether it be in their neck or their armpit or their groin. And so somebody might take a piece of that lymph node to look at it under the microscope, either with a needle, or a surgeon may actually remove that lymph node for further inspection. A person who's newly diagnosed with diffuse large B-cell lymphoma should familiarize themselves with their treatment team. And so the treatment team will typically be led by a physician, but also involve either nurse practitioners, physician assistants, as well as nurses, as well as people within the institution that may help schedule or navigate them through their diagnosis and treatment plan. And so while there may not be a specific care plan titled care plan, making sure you're familiar with your team and how they're going to get you through your journey, but also what the goals of that journey are, is very important at the beginning. So goal being, is the goal of treatment to get rid of the cancer and never have it come back? Or is the goal of the treatment to try to slow down the growth of the cancer? Currently, the most common treatment for diffuse large B-cell lymphoma for the first line would be a regimen called R-CHOP, and each letter refers to a different drug in the treatment. This is a combination of both chemotherapy, steroids, as well as a targeted antibody called rituximab, and that's been the standard treatment for diffuse large B-cell lymphoma for about the past 20 years. So overall, most people are cured with the standard treatments. So in an unselected patient population, meaning all ages, medical conditions, stages, approximately 60% of people are cured. However, depending on the stage, so patients with lower stage may have a higher cure rate, patients with a higher stage may be slightly lower. Patients with more aggressive features or other medical conditions that might prevent the ability to give the full doses of chemo may also have a cure rate lower than that expected 60%.